what you just saw in that film was a therapist asking the question, what is your chief complaint? And the reason why the therapist asked this is in order to gauge whether or not the patient had any type of awareness of what was going on. Also, in order to see what exactly was, why she was there in the first place. And the patient, unfortunately, didn't seem to have any kind of awareness or ability to recognize what she was going through at that point. There were many questions asked to see if the patient was going through any type of mood disorders. The questions that were asked were like, have you been feeling sad? Have you been feeling happy? Have you been losing sleep? And those were just to rule out any of the mood disorders. And there was not any mood disorders so far. Also, the therapist asked about work to see what kind of functioning, if there was any impairment in functioning, occupational functioning, social functioning, all that stuff, to see if this disorder was affecting her reality. Also, the memory question was asked in order to see if there was any short-term, long-term memory loss, to gauge the cognitive abilities in order to see what kind of disorder it was. Also to kind of see if it was like catatonic schizophrenia or disorganized schizophrenia. Also, the question was asked, have you been using any drugs, alcohol, just to see if this was a delusion or paranoia that was substance related, and it was not in the video. And the question was asked of the family, just to gauge the family history in order to see, really what was happening to her, and that's why we asked the brother those questions. In the end, we diagnosed the patient with brief psychotic disorder. The reason why we did this is because the symptoms, they were only there for a couple weeks. It was kind of still too soon to diagnose it with anything else. If the symptom persists for more than 30 days, then that disorder will be diagnosed as schizophreniform. And then if it persists for over 6 months, then it will be diagnosed as full-blown schizophrenia. But right now, since there's just so much little time, we just diagnose it as brief psychotic disorder. Also, we didn't diagnose it as the delusional disorder because the patterns were more bizarre and also more paranoid than just a delusional disorder usually are. So that's what we did.